Hello dear patients, today we are going to review the case presented on the picture, gonorrhea of anus. A young man came to us. He has relationships both with women and with men. He is both active and passive in sex. He paid attention at the fact that after intimate relationships, burning started in the area of anus, and it only increases during anal contacts. This was burning and itch, and there were no purulent discharges. So on observation, you can see it on the picture, reddening of anal area is seen. However, there were no significant discharges. There were some mucous discharges, they were hardly visible. However, there were no classic purulent discharges from anus in our case. According to the patient, infection happened about 20 days ago, and approximately in 10 days unpleasant sensations began. So we took analysis from anus and mouth for sexually transmitted infections using PCR method. Also, smears were taken for flora from anus and urethra. Nothing was found in urethra and in mouth. Smear for flora for inflammation was also normal. There was no inflammation in the canal. Smear test for flora from anus done in laboratory was also normal. However, gonococcus was found in PCR analysis, and this allowed us to set the diagnosis of anal gonorrhea or gonorrheal proctitis, although there was no proctitis, inflammatory reaction in smear itself. So this case can be regarded as subacute course of gonorrhea. I wouldn't call it a carriage, as there is redness, there is some inflammation. However, there was no purulent process that is so widely discussed on the internet or in different descriptions. It was absent in our case. So after setting the diagnosis, a 10-day course of antibiotic therapy was done in combination with longidasa enzyme. Local installations were done together with it. After that, control analyses were taken and they were negative. Symptoms of such burning, itch, disappeared approximately on the 5th-7th day, as this could have been related to the fact that not only gonococcus is involved in inflammation, but corresponding flora of anus as well. Our case indicates that not necessarily there must be such bright manifestations of gonorrhea as described in different sources. Anal gonorrhea may have almost an asymptomatic course. We have to always ask men what kind of contacts they practice, and we shouldn't forget about smears from mouth and anus, as in some cases it helps a lot. In our particular case, gonorrhea was not found in mouth or in penis, it was found only in anus. If it is necessary to diagnose and treat sexually transmitted infections, you can consult venerologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of sexually transmitted infections. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.